Hello and a warm welcome to another edition of To The Point. Ayushman Bharat is one of the largest healthcare programs in the world, which has been designed and conceptualized by the Narendra Modi government. It has moved one step forward with a recent cabinet approval to the modalities of its implementation. What is the larger framework of this healthcare program and how will it unfold? Joining me now is Union Minister for Health and Family Welfare, Mr. JP Nadda. I welcome you on the program.
Thank you.
Mr. Nadda, let me begin by asking you that the National Health Protection Mission promises an annual insurance coverage of 5 lakh for 10 crore families. Now, if a layman has to understand that, how does a scheme translate? How would you explain that?
You see, it's a health coverage for taking care of part of secondary health care and mostly the tertiary health care. First of all, I must thank Honorable Prime Minister for visualizing this National Health Protection Scheme, and it is a very bold decision which has been taken because it happens to be the world's largest healthcare protection scheme. In this scheme, we envisage that the procedures for tertiary health care, approximately more than 1,300 procedures have been identified.
Tertiary and secondary, both?
Part of secondary, because other part of the secondary is taken care by National Health Mission also.
Okay.
So that we are taking care. So the procedures which involve a lot of finances, which needs money, and because of those procedures, nearly lakhs of people were coming below the poverty line because of the expenditure they used to do on health. Keeping that in view, we have started this Ayushman Bharat, which is also known as very popularly known as Modi Care, where we are trying to see to it that the patient gets the facility in government and in private empaneled hospital for these procedures, and it will be a payment to the institution which will be cashless and paperless.
Okay.
And the only thing which they will have to do is they will have to be the people who are entitled for that, and they should have been in the list of SCCC. Okay. So when they are in the list of the SCCC, we will try to see to it that the payments are done to the institution and they will go for the procedures.
Okay.
And all details are being worked out.
Okay.
The minor details are being worked out so that the needy is it does not have any problem, and it should not be that there should be some kind of abuse of this system.
Right.
So we are also trying to see that all safeguards will also be provided.
Right. But you already had a number of schemes like Rashtriya Swasthya Bima Yojana, then you have the Senior Citizen Health Insurance schemes. What happens to these schemes now?
They are now subsumed in the Ayushman Bharat.
Okay.
The RSBY and Senior Citizens Health Scheme, both of them have been now. They will be part of this Ayushman Bharat, and they will also be getting a coverage now of 5 lakh.
Okay.
And to per family. So that has been, and we have learnt a lot from the RSBY schemes, and we have tried to see to it that from the learnings of the RSBY schemes, we make this more robust and more factual, so that the needy people get the benefit out of it.
If you look at the RSBY scheme, people said that, and as everyone knows, that 1/6 of India's population's out-of-pocket expenditure goes on health. So the main worry is that once Ayushman Bharat gets unfolded, gets implemented on the ground, will we be able to curtail this out-of-pocket expenditure?
40% of the population of the country will be getting this coverage. Approximately nearly half of the population will be covered in this program. So because of this, we are very clear that the out-of-pocket expenditure is going to reduce.
Okay.
Because the procedures are being taken care, and it is all high-end procedures which need a lot of financial support in private and in government medical colleges also. So I don't only think, I'm confident about it, that this is going to reduce the number of people who were coming down to the below poverty line.
So is the government planning to go phase-wise, like in phase 1 you have 10 crore households, maybe in phase 2 you would try and expand the scheme? Is it going to be something like that?
You see, first of all, at this point of time, we have decided to give to the SCCC data.
Okay.
We are trying to develop a very robust system. We will be learning from our own experiences also. And we'll try to see to it that this program stabilizes. It's a huge task. It's a huge task which we have undertaken, and it needs a lot of input which we are trying to give. It needs one of the best IT applications, and we are trying to see to it that countries and world's best IT applications are available for us, and we are working on it. By the end of by the month of July, we'll be ready with the IT applications. And when that application is available and is applied, we'll see to it that how this program stabilizes. Once it stabilizes, then we will take a call on it.
So you're saying that if by July your IT applications will be ready, then hopefully around 15th of August or somewhere nearby, are you going to announce the formal launch of the program?
You see, depends upon many things. How much stabilization has taken place, number one, and the call is to be taken by Honorable Prime Minister. But yes, we will be ready by July. That is what we are trying to see to it.
Okay. And given the small window you have, because this is one of the largest social and healthcare programs, it also has a lot of political ramifications, because the party's success or failure probably would be judged by how soon this implementation takes place. So a lot of political risk also at the moment is on your shoulder as well as Modi ji's shoulders. So
I agree, but we don't work. Prime Minister Modi ji does not work on political considerations. It is the human consideration. It is the human touch and the human feeling which has made him to come out with such an exhaustive healthcare policy,
right,
because it is going to help the poor and try to see to it that their life becomes more meaningful and quality life is given to them. So that is our consideration.
Right.
And we are not worried about the political consideration, because we are honest from our core of heart that we have to see that the benefit reaches the poor and the needy and the vulnerable.
Right.
So keeping that factor in view, we are confident that when our intentions are clear, there may be some hiccups, some problems, but we'll see to it that how do we manage, and we will try to overcome all those problems.
Mr. Nadda, coming to the premium bit, there's a lot. I mean, there's a little lack of clarity as to how and in which manner are the premiums going to unfold. Are we going to have one premium throughout all the states, or the premiums will differ from state to state?
It is for the states to decide. They have to take care. They have to come forward. We have given them the details. We have given them the requirements. We are sharing with them. It's not only the state, it is also the center. We both are going to deliberate on it. And let's see how it unfolds, and accordingly we will decide.
So what is the proportion of funds which is being decided? Because all the reports which have come out post-budget say that it's going to be like a 60-40 ratio between the center.
It's going to be a 60-40 ratio, and the states have agreed upon. And there was a consultation in the month of March itself. In 15th, 16th March, we had a very detailed deliberations on that. And the states were given the details of it. We have shared all major aspects of the program, and they have given their consent. So we both go together in 60-40, and for hilly states 90-10.
So, Mr. Nadda, while these deliberations are on, there are many states which have their own health insurance schemes, like Arogyashree in Andhra Pradesh, then you have Mukhyamantri Swasthya Bima Yojana in Jharkhand and Uttarakhand. Now, it's not very clear what these states will do with their own individual health state schemes. What
they are going to continue with that, and they are trying to see to it. It is for the states to decide what they have to do about their program. But I'm told that the states were very eager to take our national health protection scheme, Ayushman Bharat, and they also want to see to it that the finances which they were giving for the SCCC people, that because the government of India is going to give, so they are going to also enhance their own schemes and see to it that they also give to the tune of 5 lakhs to them.
So there's not going to be any duplication of anything.
There's no duplication.
Okay. Mr. Nadda, talking about the broader framework of how and what's the structure of this entire body going to be like, what we've read in the cabinet note is that you are going to have a National Health Protection Authority, there'll be a proper board which will have members. So what is the structure going to look like?
You see, you are very correct. To implement this world's largest health scheme, we need some regulatory authority and we also need an authority to implement it. Right. So what we have is a National Health Protection Scheme Council, which is headed by the Union Health Minister. And it is co-chaired, it is the vice chairman of that council will be the vice chairman of the Niti Aayog. Then we will be having a National Health Protection Scheme Board, which will be chaired by the Health Secretary of the Union Government, and the member health of Niti Aayog will be the vice chairman of that committee, and the convener will be the Niti Aayog. And we will also have a National Health Protection Scheme Agency. This will have an independent CEO, and this CEO will implement. The council is going to work on the policy matters, the board is going to regulate it, and the agency is going to implement it. And the agency is going to work in cooperation with the states to see that how it is being implemented at the grassroots level.
Okay. So this regulatory mechanism which you are talking about, as far as the fighting out corruption is concerned, earlier also we've seen that a lot of cases of rampant corruption have come up in earlier cases. But now, since this is going to be a totally new structure, how do you really ensure that no red tapeism, no corruption takes place?
See, what we are trying to do is...
You'll have punitive measures also.
Yes, we'll have punitive measures. We are developing grievance committees.
Okay.
And grievance committee will be people from all walks of life and people from public life, so that they keep an eye on it and they receive complaints, they educate accordingly. And within the system, we are going to develop a lot of self-check systems and mechanism, and we are also going to take help of IT tools to see to it that anywhere, at any place, at any given time, any malpractices is being played or being done. So that will be automatically checked.
You also talked about an apex council, and since it has to be a coordination between the center and states, so are we going to see something like how GST Council has functioned in the past in all these months? Is it going to function somewhat on the same lines?
Not exactly like that. It is a council where consultations will be done, and from time to time we will see to it that what the states are getting, what states are feeling about it and what feedback they are getting, and accordingly some policy changes are to be made, will made from time to time. But it does not have any structure like this that the meeting is to be convened and then voting is to be done or something of that. So it's not like that. It is a consultative body.
Okay. Another pivot of the National Health Protection Mission is other health and wellness centers. So far, when you talk about the healthcare system at the primary level, we've seen rickety primary health centers, across the country. Some are functioning, some are not functioning. But the new health and wellness sector, the centers which are being spoken of in the cabinet note, what are they going to look like? Are they going to look like some swanky buildings where you're going to have all the facilities for the people who are going to come in? What will they look like?
First of all, I'd like to tell you one thing, that this Ayushman Bharat is a comprehensive healthcare where we are trying to work. For long, the health policies have been working in isolation, in silos. Sometimes they were concentrating on tertiary healthcare. Sometimes they were concentrating on primary healthcare.
Right.
Sometimes they were concentrating on secondary healthcare. But there was no comprehensive healthcare where we are talking about. The 2017 health policy speaks very clearly that we will go for universal health coverage with preventive and promotive health care and a comprehensive health care. So we have tried to strike a balance between primary, secondary and tertiary. Now Ayushman Bharat with National Health Protection Scheme takes care of the tertiary health care and part of secondary health care. The comprehensive and wellness centers takes care of the gap which was there in the primary health care. So now we are converting 1.5 lakh, 15 million healthcare sub-centers into wellness centers. The sub-centers used to take care only of the mother and child reproductive system. So they were taking care of the family welfare only. Now what we are doing is we are taking care of the wellness. We are going to take care of dental health care, mental health care, geriatric health care, general hygiene, universal screening at the age of 30, cervix cancer, breast cancer, oral cancer, hypertension, diabetes, so that we are able to prevent them. So it has got nothing to do with the buildings. It has to take care of both the hardware as well as the software. And for that, what we need is manpower training at the sub-center level, recruitment of people. Last year we took 14,000 sub-centers converted into wellness centers. This year we are having an ambitious plan of 50,000 health centers to be converted into wellness centers. So it needs recruitment, it needs training, it needs improvement in the building also, improvement in the equipment also. All that has to be taken care. And so after this, with Ayushman Bharat as in what we say, the pyramid is complete. We take care of the primary health care, which is wellness center, where we have universal screening. We take care of secondary health care, where National Health Mission takes care of primary and secondary health care, and the tertiary health care, where it is taken care by National Health Protection Scheme.
So when you talk about this complete pyramid of the National Health Protection Scheme, you say it's both hardware and the software. So then comes a crucial question that how do you really get the funds for it? Because it's an ambitious program, and many insurance actuaries and many people who've spoken after the announcement was made in the budget, and they said that you need about 20,000 crore in the first year, and if you have to expand it further, it will amount to about 50,000 crore. Now, from where will you get the funds?
Question of funds has never been a problem.
Okay.
The day Modi ji took over, health has not seen any slash in health budget. And there are various schemes which have come up without being provided in the budget at that point of time.
Okay.
Like I'll tell you, there are All India Institute of Medical Sciences coming up. These All India Institute of Medical Sciences approximately to the tune of 1,300 crores, 1,000 crores, 1,900 crores. This is the amount which is being spent, and it has been provided accordingly. Pradhan Mantri Dialysis Yojana came, where we are spending 900 crores per year. It was not in the budget at that point of time. We developed that program. We started with 100 dialysis centers. We scaled up to 200. We scaled up to 300. We scaled up to 700. Now we have got nearly 1,000 dialysis centers. So this is how we are working. And whatever the funds are needed, that is being provided accordingly. Now last year nobody asked that how these 14,000 sub-centers are converted into wellness centers, where the fund came. And now we are going for 50,000 this year. So the funds, whatever is needed, is being provided, and that is being given to us. And you must have seen that there is an enhancement in budget of 24%, 27.7% last year. This year it is some 18%. And along with these schemes, the health budget is going to go up in many fold.
Right.
And the government of India is committed. Prime Minister Modi ji, in Modi Care, he's committed for it.
But all these people who are questioning from where the source of money will be, they say that probably it's going to come through some cesses which have been...
Yes, that also has been done with education. Health cess has been health aspect has been added. But as I tell you, that it is not the issue of funds. We should be ready to spend. The government is ready to give.
Another question related to the premiums is that if individually you talk about the families, you are covering about 10 crore households in the first go. Now, if you talk about the quantum of premium, what is the amount which works around per family, and how will it get paid?
It will be too early to decide now.
Okay.
It depends on many things.
Okay.
The competition, the quantum, the other things, the intervention of the states. So yes, by the month of July, it will be clear that what will be the premium, and we'll be giving that premium.
And obviously, when you talk about this competitive spirit, when it comes to the insurance companies as well, there will be a competitive spirit that, who offers the best. So will it be through a tender process or
All
what?
this, it will be a very transparent process. It will be where we will involve everybody,
Okay.
including the states, and all together are going to decide about it.
Okay. Another question which is related to the Aam Aadmi in the country is that when Ayushman Bharat is rolled out and its tenets are implemented well, now will Ayushman Bharat be able to curtail the overpricing by the corporate hospitals as well? And will it not, how will it impact in terms of, like, for example, we have seen cases where the corporate hospitals are overcharging like from 235 to 500%. So will those things be taken care of?
I will try to bifurcate the question into two parts.
Okay.
If you talk about Ayushman Bharat, we have got standardized procedures, and for that standardized procedures, there are rate fixed for it.
Okay.
Any hospital, may it be corporate, may it be a private hospital, a nursing home, or an institution, or a voluntary organization, or an NGO, our rates are fixed, and we will be paying for the procedures accordingly to all hospitals accordingly and according to their facilities being given.
But what we have seen in the past is that the private hospitals charge for the consumable items also, for example, syringes,
They
gloves.
can't do that.
And they charge the patients.
They can't do that.
Not at the
It
cost
is-
price, but at the MRP.
They can't do that. The package is complete,
Okay.
and package will be complete for all procedures and all facilities to be given. So everything is penned down.
Okay.
So consumables also include that. So whichever hospital is there, he has that hospital, that institution has to abide by the package according to the procedures which we have fixed. And as I told that we are working on minute details of the procedures, which procedure and what facility we are going to give, and that will be displayed. That will be told to the patient attendant and the patient also, and that will be to the institution also, and we'll be paying accordingly. So it's not that we say that X amount is there and they are going to charge Y.
But many times, Mr. Nadda, what has happened is that you walk into a corporate hospital or any five-star hospital for that matter, they'll tell you that for a certain procedure, they will charge you 2 lakhs. But at the end of the whole process, say if a patient is hospitalized for 10 days, it works to around 5 lakhs or 10 lakhs.
Who's going to pay? The institution is going to, the government is going to pay.
Okay.
When the government is going to pay, we are going to pay as much as we have decided.
Okay.
And we will see to it and ensure that the patient is not supposed to give anything extra.
Okay.
So that will be ensured. But this is one answer. I'll answer the another question also about the consumers. I have written to all chief ministers and I have written to all health ministers. I have personally talked to them that see that Clinical Establishment Act is being implemented in your state, or come out with a state legislature which is conducive to your state, but don't leave any institution unregulated.
But how do you make it binding? Because there are many states which have not.
Again, I have set up a committee also, where I have called the private people that you sit and decide accordingly that what measures are we going to take. Because it's not only giving bad name to you, it is giving bad name to the whole system.
Right.
So that is also we are working. But it is the states, and I am pressurizing the states that no institution should remain unregulated.
So do you have any kind of a punitive measure if the states are going slow on this? Because it is a matter which is related to the common man.
Here I have to say only one thing, that I can support them, I can pressurize them, but health is a state subject. They have to answer it. And what I can do is bring general awareness also, support them. One methodology we have developed, but that I will not divulge at this point of time. But in coming times, we will also see that these rates are regulated.
When you talk about the fact that, of course, it's a reality that health is a state subject, and when talking purely in context with Ayushman Bharat, we have seen that in the past the public service delivery system is actually broken, and it's full of compromises, what we have seen in the past. So how do you really effectively ensure that things will happen?
See, the insurance money which the government medical colleges are going to get, or the government hospitals are going to get, that is not going to be reimbursed. That is going to be utilized for the betterment of the institution.
Okay.
So that is going to strengthen the institution. This is a very major policy decision which we have taken.
Okay.
That the funds which will be released. So now there will be an incentive for the doctors, for the staff, and for the system to improve the systems if they want that the patient should come to them.
Okay.
So there is a methodology which we have developed, and of course in coming times there will be a competition, and what we are trying to give is better delivery to the patient, and for better delivery the government will also, the institutions will also have to come into the competition.
Okay. Now, one question related to the National Medical Commission Bill, which is still seen as mired in controversy, though of course the content and the intent of the whole thing is still not very clearly laid out. But there are a lot of reservations, say for example about bridge courses and all. How far have you moved on that?
We have deliberated on it. Standing committee has given its recommendation. We have done the deliberations. We are moving very soon to the cabinet, and will be coming out. And before going to the cabinet, I will not be able to divulge on the provisions, but we are working on it. And it will be in the benefit of the people at large, it will be in the benefit of the medical education at large, and it will be in the benefit of the medical students at large.
In many developed countries, we've seen that health is almost like a right for the people. And if you talk about the National Health Policy 2017, it is desirable in that policy that, health should become a right for the people. And now with such a big universal healthcare scheme going to be implemented soon in the country, are we going to see that health will be taken up as a right for the people?
Even if I say that it's a right, and if I'm not able to give, what is the use of it? We are being very practical and pragmatic. We said that we will give you a health assurance system where we will ensure that you should get health facility. Yeah. Now what we are doing, right from the mother gets pregnant, from that day till the child is born and till the child becomes adolescent, all health facilities are being taken care of by Government of India. Now this is a health assurance which we are giving. There was an issue related to early screening. So we have started that Rashtriya Swasth Bal Karyakram where we are screening crores and crores of children. We are giving them all interventions which are needed, all supplementations which are needed. We are giving them.
So you mean to say that you don't need a law like a food security law?
You make a law and you don't follow them. What I am trying to say is that what we are doing is that we are trying to give you all possible health facilities, and that is the assurance which we are giving. So you see, these are very good lofty wordings, right? But if you don't give, what is the use of it? What I am saying is we have given free drugs and diagnostic facility. We have accepted that if our institution is not able to give you that diagnostic facility, we will pay to the private party, but we'll see to it that the patient gets the facility. So what I would like to say that Modi government is working pragmatically to address these serious health issues, and in the past 4 years we have done it. You see, immunization program is carrying on. For the last so many years it was carrying on. But in last 2 years, it has picked up, and immunization, the increase is 6.7% per year. That is what is happening.
So what you have told me so far is that July is your deadline for the Ayushman Bharat to be ready and complete.
Yes. By July, we'll be ready for testings, and it will take some time for testing so that we stabilize the program.
And after that is the formal launch. Okay, it was a pleasure talking to you, and wish you all the best for Ayushman Bharat.
Thank you, Neelu.
So that's it on this episode of To The Point. See you next time with another personality. Goodbye, and thanks for watching.